Hi everyone, welcome back. This is the third video in the Put Your Breast Foot Forward series. The topic of this video is milk supply and comfort while breastfeeding. In this video, I will discuss milk supply specifics and how much milk baby actually needs, different breastfeeding positions, and how to be comfortable while breastfeeding. It takes up a lot of your time and you need to be comfy. So one of the biggest questions parents have is, how much milk does my baby actually need? And this question is a little harder to answer when you're breastfeeding because you can't easily tell how much milk your baby is getting and how much milk is coming out of your breasts. So that's a common question. It's a lot different than formula feeding because formula feeding, you can see exactly on the bottle how much baby is taking. So the answer to this question is, it depends. How much babies need is very much based on age, and it varies baby to baby. This image here is a great image about the stomach size of a newborn in the first 2 weeks. So, we talked about before when the baby is getting colostrum those first few days that they really don't need much because their stomach is small. And then you can see by 2 weeks, babies can take anywhere from 2.5 to 5 ounces. So that's a typical amount for babies once they are getting your mature milk. So, but keep in mind in those first couple days, baby really doesn't need too much. And the amount of milk that baby can drink from a single breast ranges a lot. So again, it depends on the baby and it depends on mom. So the range for a single breast is anywhere from 30 to 135 milliliters. Now keep in mind, about 30 milliliters is in 1 ounce. So the average volume for a single breast is about 75 milliliters, which is about 2.5 ounces. Again, that's an average. It can really range. And then for babies, the number of feeds that they take is anywhere from 4 to 13 feeds a day. Obviously, the higher end, anywhere from like 8 to 12 is typical for newborns. And then as babies start getting older, they will condense their feeds. They'll feed less frequently, but they'll take more at each feed. The daily milk intake for a baby, again, we see a huge range here, 16 to 45 ounces, but the average falls around 25 ounces for babies. And also of note, as babies get older, like I just said, they will take fewer feeds, but their daily intake will remain about the same. So the amount that a 4-month-old is taking is probably going to be very similar to that baby when they're 6 months old. Although when they're 4 months, they may have 7 feeds a day. And when they're 6 months, they may take 5 feeds a day. It just depends on the baby. But keep in mind that even if they're taking less feeds, they're probably still getting the same amount total daily intake. And a couple key points here is, yes, we can't know exactly how much is coming out of your breast every feed and how much baby's taking. Especially at the beginning, just let baby nurse when they want to. We talked about those hunger signs and that when they're hungry and they're telling you they want to eat. And let baby decide when they're done. Babies will typically, when they're done, they'll relax. Their hands will open up. They'll just look really relaxed. And a lot of times they'll take themselves off your breast. Sometimes they'll want to stay there and keep sucking for comfort, which is going to be different types of sucks than when they're feeding. And you'll start to pick up on that. Look for those cues, for those swallows and the back of the jaw moving. If they kind of remove themselves or they're on and off, you know that they're probably done and you can remove the baby. But try not to remove baby prematurely because they're going to eat until they're full and they're not going to overeat. They're going to let you know when they're full and they'll be done. So, we talked about this before. Many mothers worry about their supply. And when we use the word supply, we mean how much milk a woman is producing. And moms worry, is it enough for their baby? Remember we talked about in the, last video, we discussed how we know if baby is getting enough milk. And there was two things. Are they having enough wet diapers and are they gaining weight? If they're doing both of those things, your supply is probably good. Another thing to keep in mind is that your breast size is not correlated with how much milk you make. Think back to that anatomy of the breast. Remember we discussed that it's that glandular tissue that determines how much milk you make. A woman's breast size depends on a lot of things. It depends on connective tissue and fat, but that glandular tissue is what's making the milk. It's not all this filler material in breast that's making the milk. It's that glandular tissue. So that's what's determining how much milk you're making. So you may have a woman with a very small chest and she makes tons of milk, and you may have women with very large chests who don't make enough. So it doesn't correlate. Breastfeeding is really, it's literally supply and demand. So baby in those first couple of weeks will increase your supply by feeding a lot frequently. We talked about cluster feeding in the evenings. So they build up that supply and you really want to keep the demand going. So your body knows to keep making milk by you feeding your baby. And your body knows to make more milk when milk is removed from your breasts. So that is a key thing to keep in mind, is that milk removal is what signals your body to make more milk. Now, women can have issues with supply, so that is a legitimate concern. It's not something that tons of women face, but it is something that you might face as a breastfeeding mom. So when we talk about oversupply, very simple. It means you're making too much milk. You're making more milk than your baby needs and is taking. And this can happen when women pump too much, when they are basically telling their body that they need to make a bunch of milk, and so their body thinks that baby is removing all this milk, but in reality, baby might not be drinking all of it. And we are going to talk a lot more about pumping in video 4 and other issues with oversupply in video 5. So we'll provide more information on that. Undersupply is the opposite. It's when you do not have enough milk for your baby. This does happen to some women, but it's a small amount of women. And it is usually due to medical reasons. But it can also happen if you give your baby a supplemental bottle of formula, or give them a bottle of some frozen milk, but you don't pump to replace that feed. So think about it this way. How do your breasts know that baby just ate that bottle if you don't do anything to your breasts? So if you do decide to give formula or a bottle of pumped breast milk, you need to keep in mind that that can tell your body that baby did not eat at that time. Your body needs to know that baby ate to keep up the supply. You can also have a low or undersupply because of certain medications. And this is a conversation to have with your doctor or lactation consultant if you are concerned about that. If you're concerned about oversupply or undersupply, definitely reach out to a lactation consultant to be evaluated. Don't start making changes to your routine or taking supplements or anything to change this unless a lactation consultant has confirmed that you have an over or undersupply. The reason being, let's say you think you have an oversupply and you want to try and reduce your supply at home, and you actually don't have an oversupply. Now you're suddenly maybe causing the opposite problem to happen. So definitely, if you have a concern, it might be a completely legitimate concern, but make sure you talk to your lactation consultant and they can guide you towards getting your supply to where it needs to be and, you making the milk that baby needs. So we also talk a lot about supply regulation and engorgement. So in the first few weeks, You may feel very engorged, which is where your breasts feel full and tender. They may leak a lot, and this is because your supply is not regulated. That's the word we use, regulation. Now, what does that even mean? Basically, in those first few weeks, you have a lot of hormones going on. Your body is like in hormonal overdrive. It says, I just gave birth to a baby. Baby needs to eat. I need to feed that baby. That's good. But that surge of hormones can really send you through a loop. So, you may feel very engorged. Your breasts may leak a lot. Your body's just figuring out how much milk your baby needs. After about 6 to 12 weeks, it varies based on the person, your supply regulates. And regulated basically means that your body understands how much milk your baby needs, and it makes the milk more on demand. Your hormones are going to level off, and your body kind of says, okay, I get it. I get what this baby needs when this baby wants to eat, and it's going to be less in that overdrive of, oh, let's feed baby all the time. When your supply regulates, you may feel like your breasts start getting softer and less engorged, and that freaks a lot of women out because they say, oh my gosh, I'm losing my supply. Where'd my supply go? I'm not feeling as full. What's going on? Probably just means you're regulated. Again, watch for those signs that baby is eating and that they're content and that they're full and making those wet diapers. Your supply probably hasn't gone anywhere, just has regulated. And also keep in mind that how engorged your breasts are doesn't correlate with your supply. So your body makes most of the milk that baby takes on demand. Very little milk is actually stored in your breasts, so keep that in mind too, and don't worry. So can we actually figure out how much baby eats? Because it's nice to know when you're going to send baby off to daycare, or if you're leaving, a bottle of breast milk with grandma to feed baby while you're out. You're like, how much do I even leave? So it's hard to tell. If you're mostly breastfeeding from the tap, which is on the breast, you might not know exactly how much baby takes each time. Keep in mind that pumping might not indicate how much baby is actually taking. Babies tend to be more efficient at removing milk from the breast than pumps. And a lot of pump settings and parts of your pump can affect your milk supply, like your milk removal, I should say. We're going to talk more about that in the next video. If there is a legitimate concern that your baby's not getting enough milk, whether your baby's not getting enough weight or they're not making enough wet diapers, contact your pediatrician. And what they or your lactation consultant may do is do something called a weighted feed, which is you weigh baby before you feed the baby, you weigh the baby after you feed, and you subtract the difference. And that's how much baby took. Keep in mind that this is usually done in the pediatrician's office or the lactation consultant's office. Home scales are not accurate enough for this type of calculation. There's a lot of margin of error. So you do need to use a medical grade scales. That's why you usually need to go into the pediatrician's office to do that. But that's an option. So is there anything you can take to increase or maintain your supply? There's a lot of stuff. If you go on the internet and look up, increase my milk supply, you're going to see tons of products, supplements, pills, lactation bites and cookies and muffins and recipes and all this stuff just thrown at you. Increase your supply. The most important thing for increasing and maintaining your milk supply is frequent milk removal, staying hydrated, and staying well nourished. And as I mentioned before, milk is about supply and demand. So if you're keeping that baby on the breast, that's what's going to tell your body to make more milk. Now, we use this term galactagogue, which is fancy. That is basically a supplement or a food or medication. It's something that increases milk supply. There is not a lot of evidence that galactagogues are effective. There are not a lot of studies out there to begin with, and a lot of the studies conflict. So you may hear about things like fenugreek, brewer's yeast, oatmeal, certain drinks like Body Armor, things like that. People say, oh, the coconut milk, the electrolytes helps increase your supply. There's not a lot of evidence that these are actually effective. Although that doesn't mean they're not going to be effective. But I would just encourage you, before you go out and buy a $15 bag of 2 servings of, lactation cookies, consider drinking lots of water, eating nutritious meals, make sure you got enough to eat. It's hard with a new baby, and latching that baby frequently. And again, if you're worried about how much milk baby is getting, speak with your baby's pediatrician. So the next thing we're going to discuss is breastfeeding positions and being comfortable while breastfeeding. This is very important to be comfortable. You're spending a lot of time doing this. So really, whatever positions, this is a great image here with a couple different positions. What you prefer is going to depend on you and depend on your baby. So you just kind of have to try different things out and see what works for you. One thing I want to call out is that if you've had a C-section, you may find that the football hold is more comfortable because it keeps that baby's weight off of your incision. What's comfortable for you and baby might also depend on your nipple position and your breast size. The last thing I want to say about this is that if you do choose to do the sideline, which a lot of women love to do, be mindful not to fall asleep. Please maintain safe sleep practices with your baby. I know personally there were a few times I wanted to try the sideline position, and I said, I'm going to fall asleep if I'm doing this. So I have to get up out of bed. I have to feed baby in the rocking chair in his nursery. Otherwise, I'm too tired. So please maintain those safe sleep practices. Another thing to keep in mind is the actual positioning of baby. I picked this image here because it shows good alignment between baby's ear, shoulder, and hip. You want those to be aligned. If baby's head is tilted too far back, that's going to make it harder for them to swallow. If their head's too far forward, if they're scrunched up, or if they're turned, their upper body sometimes turns. That can all make it harder for baby to nurse. So make sure baby is nice and lined up. This is a great picture of that football hold. And of course, the mom is using a pillow here. Also of note, if you're doing the cross cradle, or the cradle hold where baby is in front of you, you want to tuck their arm, the one arm that's closest to your body, maybe under your arm, in your armpit area, because otherwise both of their arms are like this while they're trying to nurse, and that can make it more difficult. But again, just try different things out, see what works for you. Next thing we're going to talk about is positional aids. This picture I've included here is of the My Breast Friend pillow. I've never used this pillow, but a lot of women swear by it. Personally, I have a boppy, which is just like the C-shaped pillow. You can just use regular old, bed pillows to prop. Personally, I didn't use my boppy very long for breastfeeding. I felt like it wasn't quite the right positioning for me and my baby. But again, it just depends on you, your body type, your baby. Try some different things out, see what works. Also keep in mind of your body ergonomics. Just make sure that your back is supported. Sometimes it's much more comfortable to have your legs up. If you have a recliner, a rocking chair with like an ottoman, put your feet up and try and relax. The other thing that we tell women to do is to make sure you bring baby to your breast. Don't bring your breast to your baby. So that means don't slouch over your baby. That's going to hurt your back. Make sure you bring baby to you, to your breast, and if that means you need to put a pillow under you guys to make it easier on your arms, then do so. Partners, we haven't forgotten about you. Bring mom comfort items while she is feeding baby, whether that's some warm washcloths for her engorged breasts, nipple cream, nipple pads. What I did is before I had my baby, I put together like couple little caddies of supplies. I had one next to my bed, I had one in the nursery, and I had one in our family room. And in it I had nipple pads. These are disposable nipple pads. Personally, I like to use the reusable nipple pads. They're cloth, they absorb. If you're going to use these, make sure you change them very frequently and you wash them right away so they don't get any kind of stink to them. In it, I also have nipple cream, a couple different types, Vaseline, and hydrogel pads. We'll talk about these a little bit later. But just basically all of my necessities. And on top of that, put in there snacks, granola bars, you know, those individual baggies of snacks. Put in drinks, whether it's like some kind of electrolyte drink or your water. You're going to get one of these at the hospital when you have your baby. I joke around, this is the trophy for pushing out a baby, is you get one of these. Of course, it's the baby is the actual trophy, but they're going to send you home with this, and you're going to say, that's a huge jug of water. You'd be surprised how many jugs of water like this you go through when you're breastfeeding. So partners, make sure these, you know, if you have these caddies around your house, make sure they stay stocked. Offer to bring mom some water, some snacks. Just say, do you need anything? Have your phone on you so she can text you if something comes up and she needs a fresh burp cloth or something. And help mom get comfortable with pillows. Help position baby, especially those first couple days. Whether she delivered vaginally or by C-section, she is going to be sore and tired, and her body's going to hurt. So help her out. Help position baby and get a little bit of, you know, close time with mom and baby. So that's all for that video. Join me for the next video, video 4, which is pumping and going back to work, which comes up next. Also of note, please make sure you fill out the survey. I have actually included it in the description on the YouTube video. Just look below the video and the link is actually there. And we'll see you in video 4.